Studies have shown globally that the COVID-19 pandemic has been affecting children mentally to the point of suicide. In the United States, for example, the suicide rate in children has increased significantly. The affected are teenagers who are typically at risk for depression and borderline personality disorders. Locally, consultant psychiatrist Dr. Earl Wright says he cannot say if this is the case in Jamaica, but there are reported cases of young people turning up at medical practices with depression problems.
The anecdotal report is that there have been more incidents of depression and anxiety. I'm sure research will be done to bear out the anxiety and the increased depression, but we are not a country with a high suicide rate. We tend to act out our feelings and become more aggressive than become depressed and withdraw.
Dr. Wright is asking parents and guardians to look out for any type of changed behavior in their young ones. This includes looking to see if their stress levels have increased. Here's how.
It has to be age appropriate. In the adolescent, you have change in behavior, the irritability, the not socializing, the crying spells, social withdrawal, staying by themselves. In the child, you have the bedwetting, the clinging behavior, not socializing, and some irritability, change in appetite.
Dr. Wright also gives tips on practical ways parents and guardians can engage and connect with their child or children, especially during the pandemic.
Dinner time. You have the child there with you, and if you can engage the child in habits like cooking or doing something, chores, that the child participates in these things like that you do at home. Also listening to the child.
With your health report, I'm Shamela Pullen wishing you good health.